So good morning again. My name's Will Tuckley, I'm the Chief Executive of Tower Hamlets Council. And I would like to welcome you here on behalf of the Tower Hamlets Partnership to our remembrance event to remember all those we have lost during COVID and those whose lives have been changed as a result of the pandemic, but also to celebrate the resilience and support within the wider Tower Hamlets community. And I'm grateful to all of you for joining us this morning. We were just saying, I can't imagine a more lovely place to be on a Monday morning in Bristol Red Park. So COVID hasn't gone, but I think the partnership think this is the right time to remember. And as I just mentioned, to celebrate. As elements of society and elements of the economy come back into being. This is one of several events across this week in Tower Hamlets, all marked in part by planting of trees, so new life at this time, I think is very appropriate. And we have speakers from across different sectors of Tower Hamlets, those that have led us really in all sorts of respects during what has been such a difficult time, and I'm grateful to all of those who are giving up their time to join us today. So without any further ado, I'd like to introduce the first citizen of Tower Hamlets, the Speaker of the Council, Ahmed Ahmed.
Good morning and assalamu alaikum. How are you today? I welcome everyone here to the Victoria Park to our Remembers event to commemorate all the lives lost during the pandemic and recognize the outstanding work done by the frontline workers, community groups and volunteers. We would never have foreseen that so many people would lost loved ones, suffer ill health, or face social isolation and financial hardship. Marking the pandemic will be a way for the bar to come together and acknowledge the huge challenge that we all ever faced. I also pay tribute to everyone who has worked so hard to support our community during such a difficult time. You have my sincere thanks and appreciation. I know East Tower Hamlets is best diverse in this country. Diversity is our strength. Our community is our greatest strength. So work together we can make our Tower Hamlets more stronger, more safe. Today we will hear from many speakers, including frontline workers and community representatives. There will be a showing on the short film Tower Hamlets together, and then the event will be held with a learning ceremony. To start things off, I would like to introduce the Mayor of Tower Hamlets, Geraldine.
So first of all, this event is an event of the Tower Hamlets Partnership, so it's not the Tower Hamlets Council gig, it's something which is the partnership, and the partnership is a sort of, if you like, of ourselves, the health service, the police, the fire and rescue planning services, the voluntary sector, private sector, many others. And the role of the partnership is to act, as it says on the tin, as a partnership, to project our work, to share our common interests, to develop strategies to help improve the situation for all of us, both selfishly, if you like, as an organisation, but also on behalf of the people of Tower Hamlets. So I'm really proud to be speaking here as the chair of the partnership. The past year and a half has been pretty harrowing, and as the chief executive and the speaker have already said, today we're launching a series of events to mark the pandemic. I was listening to my radio this morning, apparently it's possibly no longer a pandemic, it's now endemic. It's a slight change in the spelling, so that means we're stuck with it. We need to work out how to live with this virus, which won't go away. and there will still be vulnerable people affected by it, just as the seasonal flu takes people's lives. So it's a catastrophe that's happened to our community, and it's something we need to live with, and we need to be very aware that it hasn't just gone away. I'm saying that partly also because I know that a lot of people in our parish just wish it would go away. We've had a pretty tough 18 months. We'd like to get on with our lives. I look on the buses, the number of people not wearing face masks, and people crowding the pubs. I reflect that people want to get on with their lives. I do understand and respect that. But just as if you keep a tiger in your backyard, you would respect it, you would deal with it thoughtfully. So we need to deal with this terrible virus thoughtfully as well. We need to keep inculcating those messages. So over the past year and a half, hundreds of lives have been lost in Tower Hamlets. There's been a massive impact on our lives. We don't yet know really what the final impact will be in terms of the way we live our lives, in terms of the way we work, in terms of the way we relate to each other. As I said, people would like to go back, but there may be some strength in the possibility of going forward. But what we're doing this week is we are reflecting, remembering people who lost their lives. I could recite some names of people I know who lost their lives. Perhaps during this next week we can recite themselves. Lost their lives, neighbours who lost their lives, the families who've been bereaved, people who've lost their breadwinners, their loved ones. It has been harrowing, so maybe 400 or 500 people in Tower Hamlets who already lost their lives. There are 20, 30, 40 times as many people being affected personally, and the rest of us in many ways as well. This is the first of many events. This week we have planting events outside. There's planting. We'll be lighting some of our public buildings. We'll have faith community events. We'll be keeping open our book of condolence until the end of the year. I think that's been flashed up on the screen already. It's worth also reflecting that Transport for London are going to designate one of their open spaces in the borough, Brown Street Park down in Aldgate. They're going to put a memorial there to the 98 TfL workers who they know lost their lives in the pandemic. And through that, maybe we can reflect also that many of our public sector workers, I often say, I've done quite a few events related to our recovery from COVID, and steady on Rachel, and I reflect that just as if your house is on fire, everyone else runs away, the fire service runs into the house. So with COVID, many of our public sector workers, obviously the NHS, but also many other of our caring workers and others in our community run into the house to help people. We need to remember them as well. Great thing about mayors with podiums is that they go on forever. So I'll move towards the end of this by saying several points, anecdotes, observations. Forget the anecdotes, observations. So I think the pandemic in many ways has brought out the best in our community. As I said, people want to get on with their lives. We should reflect on some of the things we've learned and some things we've done. We should think about those who have served in the food banks, the advice agencies, people who volunteered. Many thousand people in our borough volunteered. Obviously, our work is in the NHS and people who volunteer with the NHS. Obviously, our council staff and many other staff. Obviously, also people who work in many other important places in the borough. Many, many thousand people have experienced, worked with, supporting each other during COVID, including people throughout our community. The world is going to change. I think we should make a pledge to each other that we want it to change for the better as a result of the COVID crisis. We want to think about a number of things. The most obvious thing to my mind is the way in which we care for each other. If you're told today is your last day on earth, do you say, shall I go to another meeting? Or do you say, shall I think about the loved ones in my life and what I've done to support them? And I think, although it can get a bit poetic and lyrical and wishful, I think that's a pretty fundamental thing. The way in which our caring services, whether it's the NHS or our care workers or others, have supported each other has been fundamental to the way we work, the way in which our community, as the same as said, supports each other by being a multicultural, multi-faith community where we care for each other. It's fundamental to this as well.
Many of you will know me. I'm the clinical director for intensive care at the Royal London Hospital, and we've been pretty busy over the last 18 months. But there's a kind of, this will be brief, but I'll split it into kind of three little sections. If we think about the challenges that we had, things changed really quickly, and we were taken aback by the speed at which things moved. Now, you might say, well, we knew what was coming, we did know what was coming, but it still came very quickly. We tried very hard to keep things going for as long as possible in between waves. We've also tried very hard to make sure that all of our services have remained open, all our emergency services, all of the elective work that needs to be done to help people, and trying to manage the rapid change between that and coming into looking after an overwhelming burden of COVID was pretty intense. But we've managed, we've got through that. I think the things that challenge us moving forward is that we're still uncertain. I don't know what winter's going to bring. Okay? I am anxious, and a lot of my staff are, a lot of my colleagues, my friends that I work with. You know, there's a lot of burnout, people are really tired. And we're also not only concerned about COVID, but we're concerned about making sure that everybody gets the care that they need. You know, we're working so hard to try and catch up with the things that just stopped. Our hospital became a COVID hospital, you know, for a period of weeks, both in wave 1 and in wave 2. And during that time, lots of other things had to be delayed and postponed. So we're trying to catch that up too. So rest assured, even if you see people sitting down just having a cup of tea, that's because they're working really hard. Okay, and they need a bit of a break. So what was our response? So some of you may have been, as in some senses, unfortunate enough to experience an intensive care unit. Okay? I think it's calm, but it can feel very, very intense, hence the name. Each bed is staffed by a highly specialist nurse, but it's not just that nurse, it's a highly specialist group of doctors, senior and junior, but also the physiotherapists, the speech therapists, the receptionists, the cleaners, you know, the faith leaders that we have that come and help us to support the families, the psychologists. It's a huge, huge group of people. And we haven't even begun to think about all the managers and the suppliers and the people that keep the thing running. Each patient has an awful lot of equipment and support that they need to keep them alive. We're kind of at the very end of where you are. And the amount of people that's required to sort of do that is incredible. We have a big ICU at the Royal London. We're a major trauma centre, we're a transplant centre, we're a neurosurgical centre, and we cover the whole region, not just North East, not just Tower Hamlets, not just North East London, but in some cases East of England, South East of England. And we have 44 beds, which is big. It's a really big ICU. We got up to 156 in wave 2. Okay? I've never seen anything like it. I think we're possibly the biggest intensive care unit in the country. We looked after nearly 2% of all of the critically ill COVID patients in the country in our ICU. And to do that was just incredible. Okay, the staff and the whole hospital everywhere just came out of the woodwork. We don't have that many intensive care nurses, but people came together. We did lots of extra training. People volunteered. People came to support. We had doctors from all of our sites, particularly Bards, who basically shut down all of their elective work and came to help us and support our ICU. And not only that, is that we were supporting the whole of North East London, so we gave an enormous amount of support to our friends and colleagues at Newham and at Whipps Cross and all the way out at Queens and Romford. So we became a bit of a centre. And it was incredible. It really was incredible, and I'm really proud of the staff that came, that just did it. I think our nurses are amazing. The best piece of news this week, they were awarded the Royal College of Nursing Team of the Year Award. So, huge thank you to them. So what about you? What about the community? Well, you've been amazing as well. You know, I think the lives have been turned upside down. We couldn't allow visitors. It was really difficult. People died without their loved ones there, and people really understand it. You know, and that was really tough. And I hope that you can appreciate the efforts that went in and the way the nurses and other staff looked after people's loved ones when their relatives couldn't be there. And I think that's really tough. Also, the way that healthcare has changed. It's very different now, you know, and I think it will be different forever. You'll see doctors online, you'll see doctors, you won't see doctors, or speak to them on the phone, but that's okay. Actually, that is okay. And perhaps that's an easier way of working. Perhaps we'll actually be able to do more for more people. It becomes a bit more, you know, community orientated. Don't fear change. I think some of this will be for the good, and I'm sure Sam will talk a little bit more about that, certainly from a GP perspective. But you also brought us out gifts. It was really nice. Thank you so much. Lots of food, lots of little presents, and just lots of general support. Going, I know you guys are really struggling with it, but thank you very much, and we really appreciate it. But I can't finish without saying one final thing. 90% of the patients on intensive care in North East London at the moment have not had any vaccines. And I cannot implore this more. Okay? The vaccines save lives, they save your community, they save the NHS, and they allow us to continue to care for people for their other problems. And I implore you to go out to the community and put this message out there strongly. I cannot make that more strongly. You know, Yes, it makes my life easier, but not really. It makes your life easier. It allows us to carry on doing what we do best, which is keeping everyone better. So thank you very much.
Can I just say a very big thank you on behalf of all of you and the community for Chris and all his colleagues. You will have got a sense from what Chris has told you, actually, of the stress, the amazing work that they've done. What I think some of the community don't understand is the level of stress and work they're doing now at this moment in time. A lot of people forget that, actually. I call it the non-COVID pandemic. And it is people who have suffered harm, distress, mental, physical, from COVID. But actually, it's the people who are sitting on the waiting list, desperate. I'm seeing patients now with conditions that I last saw 30 years ago, when it was quite common for people to present very late in their condition. And I would really hope that you give the same support to the NHS at these times of understanding, when there's a lot of anxiety and stress out there and anger that we have also to cope with. Remember that when a patient turns up and they're angry, actually what almost invariably is behind that is severe anxiety. So be nice, kind to people, and give the NHS and Chris and all his team the same sort of love and support that you've given all the way through. It's not over. We are in this together, but we can get through this. 30 years ago, when I started as a GP, I used to do all my home visits, get up in the middle of the night, certify people dead. And I remember a patient of mine died, and I got a call home, and I was at home with my young baby, 6 weeks old. My wife was ill in hospital. And I thought, what the heck do I do? So I wrapped him up, took him with me, and I thought, gosh, what do I do when I go in the door? You know. And I walked in the door and I said to the widow, I said, would you mind looking after Rao? He's now a junior doctor in this area. And she never forgot that moment. Because what that was life comes out of death. There is a future, there is hope. And in a sense, that's what we're doing here, to the tree we're planting today. That's life coming out of death. And so I start thinking about, so what is my role? What are my wishes? And I'm going to ask you to think. You don't need to share them. You can share them with your neighbours here. What are your 3 wishes? What are the 3 trees that you're going to plant that will make a difference? Well, I'll tell you what my wishes are, and they're very personal. The first wish is that we have a nurse in every school in Tower Hamlets, rather than the equivalent of 1 full-time one in every 6 schools, and that they sit on the governing boards of schools. I'm a father of 5 children. I've seen their suffering. Actually, they've made great sacrifices, the younger generation, actually, to help the older generation, like me, survive. And it's time to give something back to them. And the way we can give that something back to them is something to do with their health. And you need to know that the health of children in Tower Hamlets, for many of them, is going down. The obesity, the mental health, the self-harm in the teenage years. We have to do something about that. Type 2 diabetes in teenagers. Well, when I trained 40 years ago, that was a disease of the elderly. And then we're seeing it in teenagers. So my big wish, and my wish as a father of 5, is actually the health of my children. And I'm sure you will agree that, yes, it's lovely to get grade 9s and A stars, but actually, do you know what most parents want? Do you know what most parents will say of their head teachers? Is my child going to be happy and healthy in the school? So that's my tree. And actually, I think I'll just leave you with that one tree to think about. But as we're planting this tree outside, I want you to think about, what is the tree that you're going to plant that leaves that remembrance, that would be that message to that widow that died, that there is life after death.
Well, good morning, everyone, and thank you very much. It's really good to be here, and I want to start off by giving my condolences to the family of Sir David Amos, He was an amazing colleague. And I know that Councillor Peter Gold has just arrived, so this is a really, difficult time for parliamentarians, elected representatives, and I know it's an issue that affects councillors, mayors. Our democracy is fragile, so it's very important we all work together to protect it. And it's good to be with you all today to remember all those we've lost in the pandemic. And I want to start off by thanking Tower Hamlets Council, the Mayor of Tower Hamlets, and also Tower Hamlets Partnership, and everyone that's made this event happen, and of course to the Speaker for presiding over this important event. The pandemic, as you've already heard, has devastated communities up and down the country, and especially here in this borough. And all of us have had to pull together in a true Tower Hamlets spirit, true East End spirit, and I saw that in the way that we all work together with the NHS, with the interfaith community, with the community organisations, with local businesses, and so many others. And it would take me a long time to list all those who contributed to the effort to save lives, to protect lives, and of course at the forefront were our NHS and care workers. You've already heard those testimonies of the bravery and the courage that our NHS professionals as well as the volunteers provided, often putting their own families' concerns and anxieties to one side to protect others. And I've seen that up and down my constituency and the borough at every level, in every corner of our community. And it's that humanity that we all hold on to as we mourn the loss of loved ones. And like many in this borough, we have all been touched by death, by loss. In my own family, we lost relatives. My parents lost many friends. In the Labour movement, we lost many long-standing members. In the community, we lost very key figures that I'm used to seeing on a regular basis in community meetings, who've always been around. And during the pandemic, it was incredibly difficult because we couldn't mourn their loss, we couldn't come together. And this is one of the first events that we've been able to come together at, to remember the lives lost, but also to celebrate the lives lost. So I want to just thank you all for everything you've done. I know that the consequences of the pandemic, both in terms of the impact of those we've lost on us, will live for a very long time, but also the social consequences of the pandemic. You've already heard the knock-on effect on the health service, on our health professionals, but all the different professionals in our public services, and how they are struggling to catch up, to keep up with the backlog of work. The same applies in our schools, and I've seen that at every level. And what's heartening is to see how people are finding imaginative, innovative, creative ways to respond to those crises. And as you've already heard, we're not out of the woods. We've got a huge set of challenges ahead of this winter. So we've got to support our NHS and care workers and all our public servants. And I know that everyone will do their best to encourage those who haven't been vaccinated to do so, and also to take the booster vaccines and other protections that they can. So please keep spreading the message. Please keep making sure you do the amazing work that you do. And thank you all very much for coming together today and for all that you've done for our community. Thank you.
Good morning everyone, and thank you. So I'm Geraldine O'Donnell. I'm a social worker by trade, and I'm now Head of Safeguarding and Quality Assurance in our Supporting Families division. In March 2020, when the lockdown was first announced, I couldn't believe it was happening. I was horrified. Those initial thoughts of how I could possibly work from home after 29 years of travelling every working day into Tower Hamlets from North London was unbelievable. It was beyond my thinking about how I could actually do my job. How could I not see my colleagues every day? How could I not come into the office? Not feeling as though I was doing something to help. How would I survive working on the smallest of laptops when I had such big fingers? What about the social workers that we were asking to come into the office every day to continue to do the work at the front door teams? So I made arrangements for my sister to move in, and she took over the role of homeschooling for my daughter. Who would have thought that the usual 55 minutes of travelling to Mulberry Place from North London would take 22 minutes? The streets were empty, the approach to Blackwall Tunnel and the view of Canary Wharf was surreal those first few weeks coming in when nobody else was around. So I came to work every day. In children's social care, it was agreed that there would always be a manager available in Mulberry Place to support the social workers that were coming in every day to make sure that when we got those calls about children for safeguarding issues, that they were seen by social workers. In my role as Head of Service for Safeguarding and Quality Assurance, I was involved in the Bronze Group for the clinically extremely vulnerable children. And wow, did that group work hard to identify all of those children who were clinically extremely vulnerable. There was no automatic list produced. So between, can't see my list here now, health, education, social workers, public health, the Tackling Poverty team, food bank services, special schools and all other council departments, they came together and identified 900 children who needed to shield in those initial first weeks of lockdown. Their families were then all contacted to ensure that they were connected to the right supports, that they had access to food parcels and that they understood how they needed to keep themselves safe. Making sure those families had the right information about what they needed to do. Making sure that they weren't alone or isolated was a vital part of this coordinated work. PPE then became an area of work that I took responsibility for, collecting and distributing these to social workers, making sure that they were safe when they were going out and meeting and visiting children and families. Making sure that the children and families that they were visiting also felt safe when they were having contact with social workers was an important aspect of this work. The coordination and supply of PPE was undertaken swiftly across the council, and despite initial concerns that staff may not have access to PPE, this was quickly resolved. Supporting my own team of great workers was another challenge. They were all at home on pretty much outdated equipment and had no idea how to access Teams or Zoom. Telephone conferencing became the method in which all their work was done. Child protection conferences, reviews for children that we care for. The pain they experienced holding that phone all day long was something else. But then the arrival of the new kit happened in May 2020, and children's social care began to be all issued with new laptops that enabled us to use Teams and Zoom with such ease. The working world changed in such a fast, incredible pace back then, and I am proud of all the persistent hard work that every one of our staff put in to ensure that we reached out to all the children and families that we worked with. Thank you.
The COVID-19 pandemic has become not a challenge and challenge to healthcare and economics. It has also become a test for social solidarity. I have seen so many problem in this our society. The Tower Hamlets Council that we've been supported to our community in the Granbury Community Hall. It was extraordinary, you know. And our volunteers and my manager for the Alex Watson, she also supported since last 20 September to till now. We have been supported like as more than 100 organization, and we still been supported like as our family and the community. We've been supported as long we can do, and that's it all. And thank you very much for everyone.
Thank you very much for having me here today. Queen Mary University of London is so much a part of Tower Hamlets, and not simply because our buildings are here, but because nearly half of our staff live in East London, and over a quarter of our students, UK students, are from East London. And we work on an almost daily basis with our neighbours in the community, local residents, charities, our colleagues in the council and businesses. We've all felt the impact of the past 18 months, and like you, we've invited our staff and students this week to pause and reflect on how much has changed, and we too are planting trees, fruit trees, at Queen Mary. We're reflecting on the friends and family we've lost, the unexpected directions that life has taken, and the inspiring strength that those among us found during that time. The pandemic, though, isn't over yet, and is likely to be with us for some time yet, but I want to use this moment to say thank you. Thank you to our local schools and colleges for doing your best for our young people, some of whom we've welcomed at Queen Mary this September, and who are delighted to be on campus as opposed to online. Thank you to our local residents who've chosen to get vaccinated, perhaps despite some apprehension, and we hope we're able to welcome some of you at our vaccination centre at our Mile End campus. And of course, thank you to every single person who's working in our local hospitals, our GP practices, across the care sector. We owe you so much to your commitment and dedication over the past 18 months and going forward, and including our own medical students who chose to volunteer above and beyond to support local residents and their families during this very tough time. Thank you to every community group and every volunteer who responded so quickly to meet the needs of our residents and give every effort to support others when there was so much uncertainty. And thank you to the local businesses who supported each other, adapted their models and worked hard to get through such a difficult period economically. At Queen Mary, we had people 3D printing visors, donating PPE, providing free hot meals, volunteering at testing labs, pausing research to dedicate more time to the hospitals, start new research focused on the impact of COVID-19, working with local schools to explain vaccines, establishing a vaccine hub, or if you're a student, simply leaving home to begin your university studies at what was a very unprecedented time. Despite all those difficulties, the golden thread of community followed us from March 22 to now, and we definitely need it to continue to follow us because it's not over yet. Thank you very much.
My name is Fanoula Smith, as Will said. I'm head teacher of St Saviour's, but I'm here to represent the educational sector, and I wanted to start by saying thank you to all the volunteer organisations that are represented here today, from Abdi, who organises our weekly food delivery, to Chris, to everybody that supports us and has supported us so that we can stay open as schools. So thank you very much. Tower Hamlets is an incredibly dynamic and diverse place to work in, and the thing that makes it unique is our collaboration. It's the glue that keeps us all together and makes us stronger. This collaboration was amazing during the pandemic. We went from the feeling so upset at the harrowing times to being on Zoom, whether it was on school teams or whether it was Zoom meetings with a local authority, weekly I might add, sometimes with Christine McGuinness and Debbie Jones, and I wanted to mention them and say thank you to them for their part, even though they're not here. We're grateful for the national and international collaboration that came from this, beyond ourselves. So one of the positive things from the pandemic is that actually our digital networks are faster than viruses, and the way that science has been able to communicate for the new strains and the important movement that's happened there to share information, collaborate when we didn't do as much as we did before. School collaboration was personified by a head teacher called Paul Jackson, who is unable to be here today. He's the head at Manifield, who not only became the first hub as a school to welcome children from other schools that were closed, but also to share the donated items that were in their millions. You know, it wasn't just food, it was bedding, it was IT, it was books, and he opened his doors to the community so that they could all be shared with the whole of Tower Hamlets children, not just Manifield. So I want to say thank you to Paul for doing that. He's a shining leader because he is the kind of leader that saw the opportunity in adversity to do more, and we thank him. I would not be able to stand here without acknowledging the loss and grief and anger and isolation that the pandemic has had on families and my colleagues. An existential threat, along with climate change and social injustice, on our collective physical, emotional and mental health. I would like to take a moment to reflect on the death of a colleague, Nick Haig, primary head teacher at Marner School, who died from COVID last winter, just doing his job. The same job that everybody has been doing, the same effortless sacrifice in volunteering and going the extra mile. Teachers like yourselves are not immune, and we've been open all throughout. Staff were hospitalised and some are still suffering from long COVID, yet are ever present in our schools. We miss and thank Nick. We'd like to pay tribute to the extraordinary staff resilience and commitment to take schools online in a heartbeat. If you'd have told us that the whole curriculum and everything would be digital from the Thursday to the Monday, we'd have said no. But actually it happened. And not only did that happen, but we ended up with a hybrid model where sometimes you were teaching children in the classroom, online, and Lord knows wherever else at the same time. So teachers have been amazing at having to do that. As well as making weekly phone calls to families who could not be there as their go-to place to serve the community. We are all in the same storm, but we've been in very different boats. I would like to actually talk about hope, the hope that comes from children's laughter, the hope that comes from knowing that they can continue to learn and laugh and play together regardless of what's happening elsewhere, whether there's 2 of them in a building, 15, or whether it's 4. They are the ones that actually give us the strength to continue and to keep going when you might feel quite sad and not want to do anything else. The children's resilience is remarkable and continues to be. They've carried on learning whatever the way that we've asked them to. And they've been supported, and would like to thank people like Tesco's and Digital Communities and Clifford Chance and THED for actually giving us the kit to share with families, because there have been many. The pandemic has been a great disruptor, and some things should not be the same as they were. And I think it's a good opportunity to reflect on what things we need to change as a society. From a pandemic that's claimed millions of lives globally, and I think estimates range from 4.5 million to 16, not quite right, different calculations, to become endemic and have that balance between vaccinations and safety and not gather the storms will be an ongoing challenge. For even though the storm has passed, the ripples are all with us. Hope, gratitude, compassion, resilience and dignity is still needed to continue safely on our journey. The children and young people will bounce back because they are amazing, but it is up to us to give them and everybody else the time, space and understanding to heal. The same for each other and our community. I think planting trees whose shade may be enjoyed by future generations is a mark of hope. Thank you for planting trees and for bringing hope today.
So thank you to Philippa and Fanoula, and thank you for reminding us of the importance of young people and our education institutions. It's been vital during this time. We've also seen new teams because we've seen new functions, and I'm really pleased that we have Abdi, Malik, Ahmed, one of our COVID ambassadors, here to speak to us, and indeed I think Mark Howard, one of our COVID champions, who've been so important within the wider community. So over to Abdi Malik.
Good morning, everybody. I hope everybody's doing great in this morning. I'm speaking as a Stay Safe ambassador for the COVID project and part of the COVID champions. I would like to first begin by saying, in March 2020 was a time none of us will ever forget for the rest of our lifetime. We have all experienced a pandemic in COVID-19 outbreak that took many lives, unfortunately. And we have all made many sacrifices over the past year to keep our families and communities safe by following the government guidelines, social distancing, and not leaving homes. Through that time, I felt further changes was needed. I felt that change just came at the brink of time, in the time of December 2020, exactly the same time as the birth of my first child and a daughter, when I had received a phone call from the agency within the council, and they had informed me about an excellent job opportunity that had come by, which is the current job I'm doing now as the Stay Safe Ambassador. Through this role, it had allowed myself, along with the rest of the ambassadors, to inform, engage, and help by answering any questions that was needed to the local residents, by giving them general information of where to get their vaccinations, where to do general testings and more. And of all the examples that I can think of, which are many, there was one particular one that stood out more than ever. There was an elderly Pakistani lady who was unvaccinated. Her husband was bedbound. No other family members besides herself and her husband to depend on. She didn't know how to speak English, and my colleagues happened to speak basic Urdu. She was very vulnerable, and she wasn't even registered with a GP. Through the help of my colleagues being able to communicate with her, we had given her information to go get her first dose in the East London Mosque, and that's exactly what she done. And funny enough, we bumped into her last week, and she had the biggest smile in her face by giving us the latest update, by telling us that today she's double vaccinated and she's happier than ever. These are the changes that we have been able to give towards people, along with many others. And overall, it's been a fantastic experience, something I'll remember for the rest of my life. I just want to thank you all, everybody that is here today, every public health member that has been part of this process, along with everybody else in the council. And more importantly, it's been an honor to do this role, and more importantly than that, helping the people. Thank you very much.
I first got introduced to be a COVID champion through Mayor John Biggs, and thank you very much for that. I sent him an email one day because I was very scared about the virus that was going on. And he replied to me, giving me a lovely email and said, would I like to join the COVID champions? And I said yes, so here I am. Also, I'd like to thank Carrie Earth. She's a leader of a big family that we've got, COVID champions, that we do every week on Tuesdays, 7 to 8:30, and we have coffee mornings from 10:30 to 11:30, but she's always there, putting herself out. I'd like to thank everyone here as well, like the emergency services, the NHS, everyone here. Without yous, us public, we would be very unwell, or we won't be able to cope through the pandemic. And in the past and in the future, you're going to be there for us. I'd like to thank the NHS as well, because they've been great for us all. I also like to put a memory for, we lost, where I live in the Queen Victoria in Seaman's Rest, we lost 3 people, close friends, and family, to it, which was very sad when March the 20th when it first happened. But you know, through these trees that we're going to put out there, that's going to be a good memory for them. You know, and we're going to celebrate that through their life that they've lost, and our loved ones that we've lost. You know, and it's going to, you know, make us think a bit more now, in the future now, through this pandemic, whatever we face, we're all in it together. So I'd like to thank you very much for everyone for being here, and all my family champions. I'm representing them, and they'd like to thank you as well. Thank you very much.
Thank you to Mark, and thank you to Abdi Malik for everything that you've done and for everything you represent in terms of the resilience of our community. Thank you. Faith has been at the heart of our community response. And I'd like to ask Reverend Alan Green, who chairs Tower Hamlets Interfaith Forum, to address us next with Dilwar Khan, Executive Director at East London Mosque. Alan.
Thank you. And Mark, first of all, and this is a bit of a diversion, but thank you for pointing out Carrie, because she's one of these people that I never knew before the last year, and I only recognise her when she has her background of tropical beach. Without that, I don't know you. It has been strange, hasn't it? That different reality that we've lived through in so many different ways over the last 19 months. For me, the starkest moment that is etched in my mind was from very early on in March 2020, when I had to take the funeral of an older woman who had died of COVID. We weren't allowed to have service in church, we weren't allowed to have a service even in the chapel in the cemetery, in the City of London cemetery. And so I cycled there through empty streets in March when we were under full lockdown. And her family were represented by her 2 daughters and a grandson and a granddaughter. And we stood around the grave for 20 minutes for a service. And she had been before that in hospital without being able to have her relatives around. And the sense of grief that was there, without any of the normal trappings that make that grief passable, was awful. We just had this hole in front of us and the memories of the person who had died. And I could see the effect that was having on the family members that were there. But there was so little that I could do to respond to that. And that represents for me that sense of loss, particularly at the beginning of the pandemic, when we had not learnt to live with the difficulties that came with it. And it was all so new and so awful and so stark. And that has stuck with me ever since that moment. And I, in a sense, was fortunate that because of my role as chair of the Interfaith Forum, I didn't do very much of those funerals or of that direct care. Instead, I spent most of the year sat in front of my computer, talking with many of you, and trying to coordinate work between statutory and voluntary bodies and the faith communities. And my friends, let me be honest, trying to coordinate the faith sector is like herding cats. It is really difficult with faith communities. It is part of our strength, I think, which is just about getting on and doing things, but not really talking about them or wanting to be coordinated in knowing what everyone is doing. Council office colleagues here would be very aware of that in trying to find out what it is that the faith communities are contributing to this week. What is it that we said we're going to do? I'm not sure, to be honest. We've put that message out. We've asked the faith communities to do events through this week and to share them. And no doubt that is and will be happening. But I don't know what they are because they don't tell me. And if they don't tell me, I can't tell my council colleagues. Because faith is a double-edged sword. The good side of that is what we have seen happening over the last year from all sections of the faith communities of Tower Hamlets, of the amount of sacrificial, generous work that has gone on within those communities and reaching out beyond them into neighbourhoods and to areas of the community where it is very difficult to find contacts and find support. And they have been excellent in doing that. But the other side of that, it is the unfortunate side of faith, which makes us resistant to the world around us. And we have had so much hesitancy, well, not quite hesitancy, refusal to engage with the care that is needed under the restrictions of the last year and in responding at times to the need to have vaccinations. There are some who believe that God will look after us, that God, it would be a failure of our faith not to trust in God and to go and get a vaccine. I find that an incredible view, but it is one that is around. I think it's wrong simply because of this, that the way in which I believe that God works is through us, through our health professionals, through those who are inventive in being able to respond to the situation we find ourselves in. Yes, trusting God means having a vaccine, because it is through an act of God that we are here, and that we preserve ourselves, our faith and our communities by how we care for one another, not waiting for God to do that on our behalf. And that work has been really wonderful, that has been done by those who have gone out from faith communities and others. Is Dilawar here?
I don't think he is. I think he's standing.
Okay, that's a shame. I would like Dilawar to be here standing next to me so that we don't just speak one after the other, because it has been of real importance in my time in Tower Hamlets that we've had that solidarity together between mosques and churches and the other faiths here, that we don't just go one after the other, we go together, we stand together, and we have responded to both good times and bad times together. And that sense of solidarity amongst the faith communities in Tower Hamlets has been absolutely vital over the last year. It is very easy for us to fragment. When there was discussion about whether faith community buildings could be open for private prayer, that works for some faiths and not for others. And it was really important that we, out of an act of generosity, made sure that we stood together in saying if we can't open, if they can't open for their services, then we won't open for ours. Such solidarity is absolutely key. That was there, I'm pleased to say, before the pandemic, and the pandemic has not fragmented it. And the faith communities in Tower Hamlets move forwards in solidarity now, and also not only in solidarity with one another, but in solidarity with all of you. And with our resources and with our commitments, we want to be part of this movement forwards in hope, onwards to a better Tower Hamlets, in which we are stronger, looking back at what we have been through together. Thank you.
Thank you, Alan, and I join you in thanking the East London Mosque, other mosques across Tower Hamlets and the wider faith sector for the central role that you have played in supporting communities during this time. I also wanted to pay tribute really to the role that the wider voluntary sector has played, and it's good to see Peter here, and if you could pass on our thanks to the wider voluntary sector, that's much appreciated, and also to business. I know Ian's here and colleagues from Societe Generale. Thank you to business for all the support that you've provided, the volunteers, the assistants, that part of that wider Tower Hamlets community. Thank you. So I need to thank all of our speakers who have been inspiring and thoughtful and invaluable. And thank you to the organisers for this event. And we're now going to move on to the culmination of the event, which is the tree planting. So while we've been in here, activity has been happening up here to get us ready. We're actually slightly early, which is a new experience for us. But I think we're going to be led by Councillor Rachel Blake, Deputy Mayor, a ward member for Bow East, Cabinet Member, and Richard Desmond, the Chair of the Friends of Victoria Park. So I think we're going to move outside.
By the way, we should remember how fantastic, I'm not saying this just because you're here, how fantastic our park staff have been during the pandemic. Yeah. Our open space in the parks have been a real lifeline. We discovered this when this park was locked. It took us ages to get it reopened, but people have really depended on. Let's stand there all day and hold this one. Really depended on the open space, particularly in such a crowded borough. So thank you very much to you on behalf of all the guys and women who run our park. We'll do it all. That's it.
We'll do the rest of it. No worries at all.
Would you like
anyone else want a picture?
Yeah, go on. You want a photo with the
No,
film?
no.
Go on. Always thinking of stuff. Of course. Yes. Rachel, you can do this stuff. Yes, where's Richard, by the way? Richard is the chair, founder of the Friends of Victoria.
Chair of the Friends.
Yeah, so go on, Richard, you can say a few words if you want as well.
Well, John said about how we were so grateful to park staff during lockdown. We really can't reiterate that enough. It's difficult now this year to realise quite how scary 2020 was. And the amount of effort went into getting the park reopened was astonishing. You know, we can laugh now about having a one-way system and how we were trying to stop the cyclists from cycling and the nightmare that was. But it worked. We got the park reopened. People always talk about the expensive houses around the park and how posh Victoria Park is. It's not true. Victoria Park is surrounded by social housing and tower blocks, and people who desperately need to get to the park to get some space, and they feel they own it. You know, we call it the People's Park. Talk to people about the park, you'll soon learn how they feel about it very quickly. This park is very loved, but so are the staff. They did a remarkable job, and we're very, very grateful to them. Thanks all of you. Big thank you.
One of my favourite places in the borough. Who else do we have? Which other partners want to come and put a spade?
Come on, Abdi Malik. Yeah, brilliant. Yes, please. Abdi Malik.
What about Sam Everington? Sir Sam here.
Oh, we're here.
Where's Sam?
Sam?
Sam? Hello. Who else?
Reverend.
Reverend Green, I know, we're not going to have Reverend Green. We'll have yes,
You as well.